So today what we're doing is coming to one of the Newport fire stations to help with outreach for pre-hospital stroke triage that's performed by EMS providers in the field. I think it's a very difficult job that they have. They respond to a patient that gets a 911 call and they have to quickly triage that patient. And for them to have the clinical suspicion that a stroke is present is very important. And so our goal is to help give them the tools they need and affirmation that they're doing the right thing and bringing the patients to the right place every time. Part of what we wanted to discuss today was going through the Los Angeles Motor Scale score, the LAM score. And what that is a pre-hospital triage system that our EMS providers perform in the field when they receive a call, and they're able to see what the likelihood of a stroke is or not based on this 3-point scoring system. If a patient has a score of 4 or 5 on that scoring system, the stroke interventionalist will be notified, and we're ready, and we have the team get ready for possible stroke thrombectomy. Also, we're gonna have one of our patients that was responded by the Newport Beach Fire Department who was treated with us at Hoag Hospital, and she had a remarkable outcome.
And I pulled out, and I know I'm in the middle of the street, and all of a sudden, I just felt like I was losing control, and my arm went weak, and I didn't put the car in park or anything. He came and started to talk to me, and when I would talk, I could know what I wanted to say, but it would come out like, rah, rah, and it was weird because it was like, how could that be that I can't communicate? And he was saying, you know, we need to have you come out of the car. Rick said it wasn't 2 minutes that they were there, and there were 2 ambulances, and they came to, you know, try to get me out of the car, and 2 of them had to pull me out because I had like no control. And then put me in an ambulance, and they were very comforting and very fast, and they were on the phone. You could hear them making arrangements with the hospital. And when I got there, wheeled me into a room, and it was just loaded with people doing things, preparing things. And then I was under, and when I came out of it, I felt fine. I mean, it was just amazing. And I had full faculty, speech, everything. It was very impressive in terms of to a person, everyone who comes in to your room is very dedicated, very compassionate. Everyone is just alert and helpful, compassionate, because you really feel vulnerable.
I think Hoag has a really great system, and I think we really have stroke care dialed in. And it's not just one part, it's all of us together. It's having that relationship with EMS so that the stroke triage is done appropriately. So they bring the patient in, we're notified, we move quickly. Our ER physicians are quick to assess patients. We have neurologists who are able to quickly assess patients, who are able to come to a decision. Does this patient need TPA? Do they need a thrombectomy? We're always available. We work with them day in and day out. We have really great neurointensive care units. We have neurosurgeons who are available to help us if we ever need it. We just have a really great neuroscience institute, and we're really about treating the patient.